October 10th of every year, Uganda marks the World Mental Health Day. We at the Refugee Law Project are proud to recognize this day as we continue to serve our clients. Up until now, no attention has been given to refugees as a category yet. They present with a high incidence of mental illness. This year's theme is investing in mental health. The Refugee Law Project joins the rest of the world in celebrating this day as we appeal to everyone out there to focus on refugee mental health. How we do this is by enhancing awareness through education and advocacy. We visited 3 of our partners to share experiences and challenges in extending services to refugees, as well as access to mental health services by refugees. The first stop was the National Mental Referral Hospital, Butabika, where we looked at what makes it hard for refugees to access services.
If I talk on behalf of Butabika Hospital, really, the government has really tried to put in something. Because we have this unit. It's the first of the kind in Uganda, psychotrauma unit. So, and it's solely funded by the government. The only challenges I would put across would be related to personnel. To mention, today we have only 2 psychologists for the whole hospital like this one, against something like 8 psychiatrists, and how many 20 psychiatric clinical officers. So we are very few. We are thin on the ground actually. You can imagine one person seeing 60, and you know, with the psychotherapy you have to see somebody for at least 12 sessions, and in order to address their problems quite well, so it becomes ineffective.
The next stop was the Mental Health Clinic, National Referral Hospital Mulago. Here the clinical psychologist pointed out that much as the mental health is a priority on paper, it's not visible in practice.
On paper it is, but for example now Mulago is a national referral hospital. National referral hospital. There is no single clinical psychologist employed by Mulago. Can you imagine that? But one of the challenges I've faced has been with a particular group of patients who are the refugees. And you know the circumstances of refugees. These are people who have been forced out of their countries. They don't know the language here, they don't know the culture. And they come with lots of problems. First of all, there is a trauma from what they experience in their home country. Then they also have economic problems as well as social problems. Now, some of them present to the clinic with psychological problems, of course, but I have a big problem with most of them because of the language. I can't speak to them. They speak mainly Swahili, the ones who have come from Rwanda and Congo, and the Congolese language, and I find I can't really do so much for them. And that's why I now find, how do I help these people here? Luckily, I got to know about Refugee Law Project. I have my colleague who works there, and I've always been referring many of them to Refugee Law Project.
The last of our partners visited was UNHCR's urban implementing partner, who pointed out that marginalization of refugees in accessing mental health services.
They go to those, referral hospitals or hospitals. They are mistaken to be, people who are loaded, people who are, have money. And even it becomes so difficult, especially even, of course, the little maybe language, the little English they know. You find that expressing themselves, the sicknesses they have, sometimes it is quite a challenge. They are not able to, to understand each other.
On this day, the big message to the world out there is, let us all join hands in aiding refugees access mental health services to make the world a better place for them.